and get prepared to transition to the adult side. So the 11 topics that are included in the assessments are lung health, and airway clearance, pancreatic insufficiency and nutrition, CF liver disease, CF-related diabetes, general CF health, screening and prevention, equipment maintenance and infection control, sexual health, lifestyle, insurance and financial aid, and college and work. And all of us were a part of this in developing this, but there were different aspects of the how they divided the work up. A lot of my work was on the educational resources that actually aid to these assessments. So if a patient missed a couple of answers on the assessments, we have resources and educational links and information for them to go to after also we remediate and teach them at the visit. There's a checklist, the CF Skills Checklist, and this is huge because this actually incorporates everything, like how to clean their equipment, how do they know their insurance, who do they know to call when they're sick, how do they refill a prescription, everything that's going to prepare them to get ready to move on to the adult side. And the objective for this checklist was to help each patient develop age-appropriate self-care skills. And we are giving this to both the parent and the patient. At first, we thought we would just give it to the patient, but we decided that on the peds side, we should give it to both. Obviously, those on the adult side, they're just getting it to the patient. It's completed, it can be completed at home or at the center, but most centers have chosen, and we've chosen here to do it at the center because we've realized that when you hand people paperwork to go home, it usually doesn't get done. So we've been doing everything in the clinic. It's completed by the patient, age 16 to 25, or the support person, the parent, and both for pediatrics. And it's done annually. Right now, this is just a 6-month pilot, so we did it once, and we will reevaluate it again once we continue on with the program pilot. There's a progress report, and the objective here was to keep track of improvements in CF knowledge and their skills over time, and to develop and focus actionable transition goals for each CF patient at every visit, or at least at the first visit. And this is done also again at the center. It's done in collaboration with the care team. It could be myself, the dietitian, the RT, even the physician. And these goals are are goals that are realistic. So a couple of goals for some of my patients, like one was, and she's 18, that she wanted to start calling me when she was sick. And actually, this patient actually did for the very first time this week. So reinforcing that and really encouraging that this is great. You called me. This was the first time in her whole time of calling. And it's things like that. Doesn't need to be big, huge goals because those are never going to get attained. So we try to explain to them to figure something that they can really try to work on and that's reasonable and that they can accomplish, because that makes them feel like they've accomplished something too. A copy of this goes to the patient after the visit, and a copy is kept in a little chart that we have. Also on this, I don't know if you can see, but over here on the right-hand side is the scores of their knowledge assessment test that we give them. So say there's 10 questions on the lung health. If they get 8 out of 10, we put that on there. And the purpose of that is not to say how many you missed, but to, again, remediate at the visit what they missed and to go over. But then also to redo the assessment in the year to see after more teaching if, the next time they get 100%. And this is the educational resource guide. The objective here was to help each patient and care team member assess credible educational resources to help overcome knowledge and skill gaps identified in the CF knowledge assessment. This can be done, what we are asking to do is at the time they take the test in the clinic is to remediate the wrong answer, but also later on at home, encouraging them to go over and look and to give themselves more information on their disease and the things that they didn't understand quite well. It's completed by the CF care team member and the patient. So tips that we found for improving transition and transfer processes in general were to strive for continuous improvement. Again, small goals, success, not to so they don't feel like they're failing. Introduce the adult CF care team to the CF patient and family before transfer, which is something we do. Again, at a lot of the centers we're doing that, having quarterly meetings when patients were ready to transition and have the adult and pediatric teams together to go over the patients that were ready. Create a transfer summary form for all transitioning patients, and I must say that they really liked the one that we developed at Stanford and utilized that in our program pilot, so that was kind of good. Coordinate a formal transfer meeting prior to the transfer date where kind of like what we do here, when a patient is ready for transition, somebody from the care team on the pediatric side goes to the first appointment on the adult side. Hopefully the physician can go, that was their pediatrician. If not, it's myself or the dietitian or RT, anybody that can go to meet them in the new place. So there's a familiar face. They feel like, we're there to help connect them with the new program and the new clinic. Organize site visits to the adult hospital inpatient unit and adult CF center and clinic, and hold regular meetings between pediatric and adult CF care teams. All of these things were points that were brought out by all centers and felt that it was very important to have in order to make a successful transfer and transition. Future goals of the program, a digital portal of this exact program actually started in January, 2 months ago now. We have not started that because it came after we already did the paper enrollment, but because everybody's so tech and the kids have their iPhones, all of this can be on their phone, and they found that that was going to be much more, patients would be more adherent in doing that. So that's really exciting. And in furthering on with this program, after the 6 months and we reevaluate, it will probably all be digital at that point. And our goal is, the hopes is that it is well received and liked, and that we will roll out nationally to all CF centers with support from the CF Foundation. And thank you to all the 5 patients and parents and families who have assisted in this, and a few of them are in here, and it's very helpful because it allows us to see how this will work. So thanks. Any questions? Okay, I was going to introduce Sruthi. Shruthi is our new social worker for Pediatric CF, and Shruthi joined us a few months ago, who in the interim was working with us when Lindsay left to go to her new role, and then has been with us permanently for about 6 weeks, around there. So thank you.
Hi, everyone. I'm going to try and keep this short, sweet, and simple, but I just wanted to really take the opportunity to introduce myself as the new pediatric social worker for the CF Clinic. A little bit about me. I am from Austin, Texas. I got my bachelor's degree at University of Texas at Dallas and completed my master's at University of Southern California. And I completed my fellowship here at Lucille Packard last year in intensive care. So that's just a little bit about me, and started this position in mid-January. Okay. Hold on. So sorry, it's not showing up here.
Oh, that's interesting. Sorry.
If it's not going to work, I can just go ahead and just talk with this.
That's interesting.
It's okay, I can just speak.
Okay.
Yeah. I can just have it up here so I can at least see it. Yeah. Okay. Oh, there it is. Okay, perfect. Okay, sorry for that little bit of technical difficulty. So I just wanted to take a brief moment. I know that most of these families here have been in the clinic and they know that what the role of the social worker is, but I just wanted to bring my perspective into this as I'm starting this in this position. So I feel that the medical social worker's role is to work closely with the families while they're in the hospital and out. So that looks when you're inpatient and then when you're in clinic, and also outside of clinic, because the support doesn't stop just while you are seeing your medical team. And that's to provide education, any assistance with resources, and emotional support. And then to also, when you're inpatient, to help you navigate the hospital system. Packard is a teaching hospital. There's a lot of people involved, so it can seem like a very scary place, and it's very hard to be able to be in that environment. So I'm there to help support you through the hospitalization. So these are some of the psychosocial concerns that I've seen so far, and I'm sure that this is going to change as everyone grows in this clinic. Some of the biggest struggles I've seen is for patients feeling different from their peers, and feeling CF is a very isolating condition, and so it's hard to have peers that understand what you're going through. And also it's for the families as well, because you're not always situated around others who understand what you go through and what it means to have a child with CF. And then with that comes potential lack of motivation and non-adherence, because it's hard to identify and have that identity of having CF. Some of the other concerns as well is with school and that support in school and how that looks for each child. So my hope is to help support the families and parents in teaching how to be an effective advocate for your child, and also as your child grows up, learning how to be an effective advocate for themselves, as you've seen with Mary had mentioned through her RISE program. I think that that's really a lot of what it means to how to learn to be an advocate for yourself. And also the support for career and financial stressors. Having a chronic illness, there's a lot of issues with insurance as well as the out-of-pocket costs and how that plays into your daily life. And helping you navigate the relationships within your family system. You may have one child with CF and another child that doesn't have CF, and that relationship between the two siblings, and helping you navigate that as parents, as well as for the siblings learning how to build that relationship amongst themselves. And generally just coping skills and how to manage those difficult situations. Okay. So the psychosocial support can look different in the hospital and outside the hospital, and we've got different resources available to the families in the hospital, and that includes parent mentors. You've got me in the hospital that I'll come and see you and help with the emotional support of being in the hospital and navigating the hospital system. Child Life is a great support to families where they're able to help the children specifically. You know, the trauma of being in the hospital and the treatments that the CF children go through, they help with those kind of learning those coping skills to deal with that. Chaplaincy, child psych, as you can see, we're all here for CF Ed Day, and then patient relations for any concerns. And then outside of the hospital, it's parents mentoring parents, connection through email or phone. I'm here, I'm accessible by email or phone. And then support groups, which I know a lot of you have tapped into the community, as well as I'll talk about my my hope for the Center for Peds. And then counseling services and psychiatric services for both patients and families. So as I had mentioned, part of my goal for this year is to look into support groups. And my initial thought was an adolescent support group and newborn mothers, newly diagnosed patients of CF, and a support group from them trying to navigate what it means to have this chronic condition. These are just initial ideas. And then also on top of that, my goal is to learn the insurance process, because that is a huge beast for everyone. And I would like to be able to learn a little bit more to help support the families. And then most importantly is to get to know each and every one of you and get to know your families and hopefully build relationships where I can help support you guys through. Okay? Any questions, concerns? And that's my contact information if you need it. I have my business cards. If I haven't met you, I'd love to meet you. Okay, thanks.
Any questions?
Oh, sorry. Adolescents, it's going to be difficult to be in the group physically together, but my hope is to kind of look at what the adult side has done with their support groups and kind of bring that idea to the adolescents. And you know, they've done really well with social media, with their Facebook page, and that's something that I'm thinking about, because adolescents are so connected with technology, and social media is trying to implement somewhat of a support group using social media as well as maybe the WebEx that they do. And then for newborn mothers, it can be, you know, it's hard to leave your newborn at home and then come to one place for a support group. So what is going to work best for those families? Maybe have that option of Skyping in and physically being present. Yeah, thanks. Okay. Okay. Thanks.
Thank you.
Thanks.
Thank you, Sruthi. Okay, so you've probably seen all the construction around. Means that, you know, we have a lot of upcoming major changes, and that includes also our information systems. So I want to thank Tom that he's going to give us an update of how the electronic medical record is going to be accessible through MyHealth and what kind of information you can get directly. And
I'm actually going to swap out computers real fast.
Okay.
I'm going to do a live demo.
All right.
Just 1 second. There we go. So my name is Tom McPherson, and I'm one of about 100+ people that have spent the better part of 2 years building the new electronic medical record that's going to be in place, swapping out what we have right now, a program called Cerner, putting in this new program called Epic. My specific role is I'm in charge of the portal. So I'm building the patient portal, which is what I'm going to talk about, how you communicate with your doctors, get results and information, and also the MD portal, so where referring physicians can make referrals, see their patient's medical record, and that sort of thing. Though I'm a resident nerd now, I actually started at the old Children's Hospital 30 years ago in April as one of the nursing staff. So I have been here before Packard was even built. I've been here at nights and evenings. I've done all kinds of stuff at the hospital. Like I say, now I'm the nerd. which just makes it really way more interesting for me. And I'm really happy I got invited because I spent a lot of time in a cubicle, a lot of time looking at a computer screen. It's nice to see humans. 30 minutes is not a lot. I'm going to try and hit the highlights that I think you'll be interested in. If I miss something, ask me. I'll give you my name and number in a second. I'm going to try and cover what we call secure messaging, which is how you can communicate back and forth with your physicians and staff, how you can get your lab results and medication, you can do refills. Something that the clinicians might want to use, we can develop questionnaires that we can send out through it's going to be called MyChart, where you can send questionnaires out, get information back. Flow sheets where you can track symptoms in real time and you can do stuff at home and get it back to your team. I'm going to try and talk about the really thorny issue of teen access. There's a lot of laws and about what teens can have access to and what parents can have access to. I could spend 2 hours talking about that. I have a feeling I'll raise more questions than answers. And then I'm going to cover mobile access, which is basically you'll be able to do this on your mobile phone. So I'll skip that and we'll get done on time. I also think this is going to be one of the few demos that are going to be just as interesting to the staff as well as the patients and families, because folks are going to be seeing Epic for the first time in some ways. Hold on a sec. Because I'm doing a live demo here, that's the difference. I'm not giving you yet another PowerPoint thing. So basically, MyChart, it's going to be called MyChart. At Stanford, it's called My Health Online. This is really the view into the medical record that patients can have. This is still a work in process. There's still some design, but this is 90% of what it's going to look like. You can sign up in your clinics. You're given an activation code so that only you really know what patient you're getting into. There's lots of security involved. So you get an account, which I'm not going to spend a lot of time talking about, and this is what you're going to come to. Being a pediatric institution, it's going to be the situation where parents or a legal guardian are going to be signing up to see their children's information. So it's a little different than Stanford or most places. So what I have here would be the home page of a mother named Jan who has 3 kids. So you can if you have multiple kids at the hospital, you can have all their information in one site so you can get them, you can switch around. You can put in pictures. They have different colors, different ways to help you remember who you're working with. But the mother would have an account where she can send messages, she can change information, but she's not going to have a medical record, so there's not going to be any medical information to see. Zoe's her youngest child, in this case 8 years old. And so this is where you can do the kind of work. And probably most of you have something like this with your own healthcare providers. It's pretty much like most places. In the messaging, you can you have an inbox just like your mailbox where you'll get messages back. You can get information from your providers. You can always tell if someone's read or not read their messages, whether they're highlighted, just like in your email box. If you wanted to send a message to your care team, essentially you can do that. You can select from a list of providers. I was working with the Dorsey Bass's team, so it's not pulmonary, I'm sorry, but essentially you can send a message to providers that you've had appointments with either in the recent past, the last year, or have something scheduled in the next 6 months. So you can message relevant team. You can pick a question. You can send a medical question. There's various categories. These will go to a pool. So they will go to a group of people in a particular clinic that have the clearance to have a look. If it's simple, like I need directions to the clinic, they can just fire back a message. If it's clinical information that the doctor has to review, they can forward it to the doctor. And you can just fire off a message. You can attach a picture or an image to this if you have something you want to show, and send it off. You can, in the case of children 11 or under, you can do a medication, a refill request, and this will populate with the medication that's in our records. And you can highlight it and just go through the process, send it into your doctor's office for refill, and they can do it all online. So, save phone calls. Gets documented in the medical record as it needs. They can do signatures and all that kind of stuff. Put it in, fire it off, you're done. There'll be the ability to ask some customer service, so you'll be able to ask questions for the billing department, or patient relations will have a feedback box, or if you have website or technical help desk stuff, you can fire off messages. You'll be able to go online and request an appointment, which is probably one of the juicier, better qualities. At this point, we're not going to have what's called direct scheduling, where you actually can look at open appointments in a particular clinic's calendar. But you can say, I need an appointment with this doctor at this clinic. These are my preferences. Goes to our scheduling center. They'll do their best. Again, saving phone calls, that sort of thing. We're going to be looking in the future to some direct scheduling. I have that in Kaiser. It's fantastic. But it's just a trickier thing with a specialty pediatric hospital with long wait times, filled appointments. Direct scheduling is pretty complicated stuff. You'll be able to cancel appointments and just communicate, with the scheduling folks. Real quick on the medical records side. You can get test results back from tests done at Stanford, Packard. I'm trying to get used to calling it Stanford Children's Health too. We had a new name, a new brand. You can get information back. You can look at past results. You can graph results across time. So there's different display items and really see various values and that sort of stuff. You'll have your current medication list, and you can see all the medications that are currently active. You can go right back to the refill function that I showed you before. Get allergy lists, all the kinds of stuff that you need for school or camp, summer, sign-ups and stuff like that. Get your medical history of immunizations. There's some other neat features. There's Lucy, which is a personal health record where you'll be able to download information directly into a USB or something like that, take it from different hospitals and things like that. You can download parts of your record to that. So you're seeing a pretty extensive part of your medical record and really being able to do actions that normally you'd be doing on phone. So tons of convenience. And like I mentioned, you'll be able to do virtually all of this from your cell phone. Questionnaires. Dr. Bhargava did a sleep questionnaire where you could send out to when you first sign up in the clinic, it goes out and will ask tons of questions. I picked someone that doesn't have any questionnaires, but I'll show you something on the other side. This is where the staff might be interested. This is actually a view of what it's going to look like, what Epic is going to look like for the clinical users. Sorry, I'm having a little, my two screens are melding a little bit.